Zoom presentation today. This is Allie Orwig with the Indiana Rural Health Association, and you are joining one of our Lunch and Learn sessions. Very excited to have the team from Purdue with us today. We do ask that everyone hold your questions until the end of the presentation, but if something pops in your head while they are speaking, we have these really handy chat and Q&A functions you can find during the presentation by hovering your mouse either at the top or the bottom of the screen, depending on which view mode you happen to find yourself in. You can use either of those functions, and I will be keeping my eye on those and act as moderator at the end of the session. We'll make sure everybody gets your question answered either today, or I'm sure all of our presenters will be happy to get back to you and find the answers for you. We are also going to record today's session and have that available on our YouTube channel. So if you aren't able to join us live for the entire session, please contact me at aorwig@indianarha.org. So aorwig@indianarha.org. We'll be happy to get you the link to that. Or find us at Indiana RHA on YouTube anytime. We have most of our Lunch and Learns archived there, and a lot of other great content that you can check out covering a wide range of topics. But without further ado, we'll go ahead and turn it over to the team at Purdue to introduce themselves and kick off today's presentation.
Hey everybody, thanks Allie. Happy to be here to talk a little bit about our work with the Community Health Workforce Development Institute, which has been in existence from our minds for just under a year now, but really happy to share all of the work that we've done in such a short amount of time, and happy to entertain questions as they arise. So please feel free to make this more of an active discussion. We're happy to try to address those. This presentation today, we'd really just like to talk about what we hope to accomplish with the Community Health Workforce Development Institute, and go over what we have found to describe the current landscape of CHWs in Indiana, including results from our initial needs assessment where we conducted a series of interviews and focus groups to compile some necessary information to kind of characterize the landscape of CHWs, and also surveying CHWs themselves to ascertain this information, and also with the lens of identifying future opportunities for the CHW workforce in Indiana. So that's where we're really going to focus our content of our presentation today, and again, happy to entertain any questions. This is our team, and 3 of the 4 of our team are here today. And starting from the left, we have Dr. Natalia Rodriguez, who's an assistant professor in Purdue's Department of Public Health and the Weldon School of Biomedical Engineering. And she has expertise in community-based participatory research, human-centered design, as well as experience training community health workers. And she's been at Purdue since 2019 and brings a lot of expertise, especially from the academic model for CHWs. And then the next individual on our team is Dr. Yumari Ruiz, who's here with us today. She's also an assistant professor in Purdue's Department of Public Health, and her research and practice focuses on reducing health disparities and identifying factors within vulnerable populations, particularly youth, to cope with and overcome and thrive in the face of diversity. And particularly in the Latino community, at-risk youth, and again, to really meaningfully address health disparities. And then that's me, also on the screen. And I have been practicing clinically for Eskenazi for over 13 years now, where I work with medication management for people with high cardiovascular risk, particularly diabetes, hypertension, dyslipidemia, and smoking cessation, for the underserved populations at Eskenazi, particularly in 2 clinics where I'm at, for those who primarily speak Spanish, and also for those with serious mental illness. And my research interests have related to a number of topics related to cardiovascular health, and particularly diabetes. And I have a lot of expertise in the national and state and local advocacy space as well. And last but not least, we also have Dr. Ashley Meredith with us here today. Her clinical practice for Eskenazi mirrors a lot of what I just said in different clinic sites for people with high cardiovascular risk. And she focuses a lot of her research efforts, again, related to her clinical practice, but also access to hormonal contraception, as well as qualitative methods, looking at pharmacist provided services as well. So with our expertise combined, we have a really strong team who make up the Community Health Workforce Development Institute, looking to accomplish a number of different things that I've listed here on this slide. There's a lot on this slide, and so I will focus by column or box. If we start on the left-hand side, you'll see that part of what we hope to accomplish is through CHW development and also partnering with INCHWA, the Indiana Community Health Workers Association, to accomplish core competency-based training, as well as providing sector-specific skills training, as well as a pathway to CHW certification and additional career development opportunities. So we've spent a lot of our time up front understanding the landscape with the vendors who provide CHW certification, as well as aligning our efforts with the Indiana Community Health Workers Association to really ensure that the core competency training plus additional training opportunities are really accessible to the CHW workforce. So that is one area where we spend and focus our time. Secondly, if you go to the middle yellow box, we also focus on sector-based workforce development. And essentially, we have identified three primary areas or sectors with which to help grow the CHW workforce, being academic, community-based, and clinical. Academic is unique, and Dr. Rodriguez really does have the most experience in this area of looking at a core group of university-employed CHWs as faculty research partners trained in community-based participatory research. So that is one area where CHWs are exceptionally useful. And so that is one sector with which we hope to accomplish work. The community-based sector, and this is really where Dr. Ruiz has the most expertise. And so community-based organizations, working with them to create sustainable CHW employment opportunities for community outreach and social service delivery. So community-based is also another one of our sectors, and probably the easiest one to understand for a lot of people, or maybe it's just my bias of understanding the clinical sector and looking at healthcare facility-based opportunities for CHWs there. And again, I think that's maybe the easiest one to understand or wrap your mind around. But these are the three sectors that we hope to really expand the workforce through the training, through partnering with employers, and creating sustainable policy and models there. And then specifically defining scopes of work. And we're currently engaging in a demonstration project to help kind of build this blueprint and framework for how to most effectively roll out kind of a CHW workforce within a specific organization. Lastly, our third area of focus is the evaluation and policy side of things, and all of the work that we're doing, we're approaching with the lens of evaluation in mind, and ensuring that the interventions and the projects and the work and the initiatives that we engage in really do have meaningful impact and broadly can be translated and implemented in other settings and broadly across the state and potentially beyond as well. We've also partnered with CMS, FSSA, had discussions with them to ensure that we are informing them of what we learn about the reimbursement structure and potentially suggesting opportunities for improvement there as well. So that is really where we hope to focus the majority of our time and efforts, and that's a lot. But we have a number of strategies to address each of these sectors. And this is essentially just describing what all of the information I just presented in a different way. You can see the three different columns or boxes again in the center, and how that really fits into our model. And I also have listed here some of the partners or collaborators that we have spent quite a bit of time discussing these efforts, discussing tactical kind of possibilities moving forward. We have a number of representatives from these organizations on our steering committee, which we're meeting again for the second time here coming up soon, to talk a lot about what Dr. Ruiz is about to present in the next portion of these slides. But essentially, this is a broad overview of the hope of the type of work and impact that we hope to have over the next several years, future vision. And of course, we are open to this flexing and changing as we learn more, but also as we bring on more partners and collaborators, we know that this will also be flexible and malleable as well as we move forward, because from where we started to where we are now, we have definitely made some we've adapted to things we've learned, and we wanted to start off this journey with, we need to learn and know the landscape to the best of our ability before we really start implementing the initiatives that we hope to accomplish here. So with that, I will hand it over to Umari, and I will advance the slides for you, Umari, if you just want to say next slide.
Great, thank you. And with that in mind, and guided by and informed by the insights of our steering committee and our partners, we launched a needs assessment where we were really trying to look at and understand the current landscape of CHWs in Indiana. Right now, I'd just like to spend a little time kind of just sharing some of those results. Next slide. Next slide. Sorry. We were able to capture insights from about 650 participants, which were equally distributed between male and female, primarily white, with, interestingly enough, a higher education level, many finishing technical school, some college, bachelor's degree, and grad school. The majority of the participants were certified, and their wages did go from minimum wage up to 18, primarily most of them centering between minimum wage and $14. Most of them working primarily full-time and being in the organization between a range of 1 to 10 years. Next slide. What we found when we looked at the CHWs and their indication of their country of origin is that they were from all over the world. Obviously, many of them were from the United States, but it's interesting to understand that we do have insights, very diverse insights and perspectives from individuals from across the world. Next slide. In terms of where our CHWs are providing services, they're providing services throughout all 92 Indiana counties. Obviously, some counties have or are employing or utilizing the expertise of CHWs in less numbers, but we do see a representation of CHWs across Indiana. When we asked the CHWs, next slide, what type of job titles they hold or what is their area primary sectors in which they represent, you can see that many of them do hold the title of CHW or community health worker, some of them certified recovery specialist, and then a good portion of them also doing a combination of certified recovery specialist and community health worker. But we also see the use of other titles to really kind of describe community health workers, whether that's a navigator, a peer counselor, an enrollment coordinator, and outreach worker. We also see that in terms of the primary sectors, CHWs represent a wide a variety of primary sectors, from business advocacy to government, non-government, and education sectors. Next slide. When we asked CHWs to share with us what they do, many of them shared, for instance, this participant, I serve as a resource for people that I come in contact with. When asked how do they actually engage or carry out this work, most of them talked about connecting clients to needed services. We focused on helping individuals with Medicaid to get them insured, for instance. Some talked about creating social networks that provide access to those that can actually help their clients access needed services. So for instance, one CHW shared with us, so I might not be versed in insurance navigation, but I can connect patients to insurance navigation. Or one of my colleagues is a social worker. And so I'm like, oh, so-and-so needs this, who can I connect them with? Many of them work as advocates themselves, or they advocate for or on behalf of their clients. As one CHW shared, our goal is to break those barriers experienced by clients, such as why people sit in the emergency room forever, constantly, they can't afford their medications, utilities, just can't get to their doctor, transportation. How do we break down those barriers? Many of them talked about actually providing direct service, whether that's either creating programming, providing case management, and or education. In the example of this CHW who talked about doing case management for children who have elevated blood level. And many of them also talked about the importance of really, given that many of them either are from the community themselves or share a lived experience with the individuals that they serve. Many of them felt that it was important, again, this idea of advocacy, but to build client and or community capacity. As this CHW shared, my goal is to always make sure clients educated and understand what I'm telling them and how to get what they need done and done correctly, so there's no delay in getting the services that they need. Next slide. We see that they work on across a wide range of primary focus areas, but there is a big cluster that are focused on chronic disease management, such as high blood pressure, cardiovascular disease, diabetes. And next slide. And from this, we identified some future opportunities. So I'm going to pass this on to my colleague who will continue this conversation.
Thanks so much. So I think this is the part, we were really energized by the information that we got from our needs assessment, from the survey, from doing the focus groups and interviews, and kind of, are really excited to say, okay, where can we go next with this? So we just want to talk a little bit about what we see as potential opportunities for the community health worker workforce within Indiana. Next slide, please. And so overall, as a whole within Indiana, CHW employment is projected to grow at a rate of 14% between now and 2028. So that's about 220 new CHW job openings each year, which is really a faster rate of growth compared to the average for all occupations in our state. So it really does present a growing opportunity to get people involved in this necessary workforce. Just kind of looking at the pathway to certification within Indiana, CHW certification is open to anyone that's aged 18 years or older who has at least a high school diploma or equivalent, which we see this, excuse me, as providing a great employment pathway for young people, those without higher education, particularly for those from low income or disadvantaged backgrounds. So while our survey results found that, maybe more than we expected had some higher education, there are plenty of opportunities within CHW certification for those that only have a high school diploma or equivalent. As we continue to find, the more that we talk to people doing this work on the ground, CHWs are really critical for linking the underserved communities to the resources for overcoming barriers to both employment and other drivers of poverty, like illustrated in some of those quotes that Yumari shared. We can see that critical link that those CHWs play, and we know across our population here in the state that there is a large need for making those links. And then we also know that expanding and sustaining that robust CHW workforce in Indiana is a powerful way to move us forward. Next slide, please. And so what are some of those challenges, right? Like we have all these opportunities, but it's not easy. Otherwise it would be done already. And so some of the main challenges that we've uncovered related to expanding and sustaining the CHW workforce here across the state include an overall lack of understanding about who CHWs are, the work they do, their diverse roles and titles, their potential impact, how best to integrate them into their teams. And so as a whole, this leads to them being a relatively undervalued workforce. Some of the comments that we found as we were going through our needs assessment really related to how do they show their value? What's that return on investment? What are the outcomes and impacts that need to be seen by the CHW or the employers to show that it's a worthwhile investment in this type of employee and worker? And so there really is a limited evaluation capacity currently to measure that full impact that's going to lead to the expansion of the workforce. Another barrier that we see and that we heard expressed was the underutilized and misunderstood billing framework that currently exists for reimbursement of CHW services. As it stands right now, it really leads to a lack of sustainable funding for permanent CHW positions. So we heard a lot about how either the amount of reimbursement was insufficient or CHW positions were funded on grant money. And when that grant ran out, how do you justify or find the funds to continue to employ that CHW in the valuable work that they're doing? So there are some barriers related to the framework that exists currently. And then even beyond that, there are still fragmented employment pathways, lack of career development opportunities, which may lead to missed opportunities, stagnant wages, job dissatisfaction, and high turnover rates within the existing CHW workforce itself. Next slide, please. And so based on our needs assessment and the work we've done so far, we've put together a few of what we see as key recommendations. And so we want to continue to build an evidence base for the role and impact of CHWs within Indiana. We think that is crucial to show that the outcomes that are associated with CHW work so that we can move forward in helping to show the ROI and drive support for expanding the CHW workforce. We think it's crucial to educate communities and employers about the CHW profession and impact. So like we're doing here this afternoon, letting people know about CHWs, the work that they can do, how they could be considered to be implemented within current systems and organizations that may not be considering it. We think it's necessary to facilitate access to funding to enable the CHW workforce sustainability and expansion, whether this be through reimbursement mechanisms, increased grant opportunities. How do we sustain the workforce and continue to grow it? So that's another key area that needs to be focused on. And then we would also like to share CHW workforce models and best practices across all employer organizations to optimize those strategies. So I know earlier Jasmine mentioned a couple of demonstration projects that we are working on to help develop what those models and best practices may look like so that we can share that information and disseminate it and work together across institutions and organizations to really just maximize the potential for the CHW workforce. So as a whole, we feel that our institute is poised to partner with INCHWA and other statewide partners to put these recommendations into practice. So Next slide, please. So that really kind of takes us to the end of what we had prepared to share with you formally about our institute and the work that we've done so far. We are hoping to use the majority of our time, or the rest of the time here, to really hear from you all, know how we can help assist you, what information you want to know from us. So I guess I'll just kind of turn it over if there's any comments, questions, things like that at this point.
Yeah, and I just, thanks, Ashley, for all of that. I want to, being that we are speaking to an IRHA audience, obviously our approach is broad. But when we focus in on rural health, there are obviously a lot of opportunities with community health workers and improving access to healthcare, improving access to resources. And so this is really why we really thought it would be beneficial to connect with an IRHA audience. And I've had meetings with IRHA leadership to really understand IRHA's role with CHWs. And it's huge and it's large and it's awesome and it's important. And so IRHA has been a critical piece of learning more about the landscape. And so it was really nice to have this opportunity to bring this to the wider membership for IRHA so that we continue to spread our message, because our intent and our purpose really is to be transparent and to share all of the data that we find, because in our objective to align everyone's efforts across the state, we feel that it's important to be transparent and to share everything that we're learning. And so we welcome any and all partners who want to talk to us about either their experience with CHWs or their kind of hope to work with CHWs, or any opinions really on CHWs. But what we know and what we've learned from our needs assessment, looking at the data that Yumari went over today, it really is that there are a lot of opportunities, and we know at the heart of things that CHWs really can make such a meaningful impact, particularly in areas that we know we can attribute a lot of health disparities to. So that's why we're here. We want to hear from all of you. We have some questions that we are interested in hearing from you all about, but I do want to pause here and just take some time for questions. Allie, did you see anything come across?
Yeah, we do actually have one question about the demographics of CHWs in Indiana. It's interesting, worldwide, the lower representation of Blacks and higher representation of Native Americans. And I believe that there was, and I'm reading this, I believe that there was a race slide transition before I could get a good look. This is the question that was typed in. So would you guys be willing to go back to the slide about the demographic breakdown in your survey? And then would you care to speak to that, the demographic breakdown and the lower representation of African Americans, higher representation of Native Americans?
And we agree. We looked at that as well, and we want to definitely report the data that was input. But what we believe is that there might have been an error because we allowed people to select more than one if they were mixed race, and so there might have been an error where individuals indicated or might have seen American and put it in there, because it does not actually reflect the Indiana population. And so I did want to point that out. I don't think that we oversampled the American Indian or Alaskan Native. I actually think that, and we have talked about that, but we don't want to not present it. It's definitely a limitation of the study in which that could have been an error. Everything else seems to align with what the demographics of Indiana looks like. So there was no big surprise in terms of the other demographics. I hope I answered that question.
Okay, any sense of how the demographics, experiences, or challenges faced by CHWs in Indiana compares to that of CHWs in neighboring states or other parts of the country?
I think that's such a wonderful question. So this particular study was really focused on Indiana, and in terms of trying to understand, and really the purpose of this was to try to understand what does the CHW landscape look like here in Indiana. And the purpose of that, and I think I just sort of want to share a little bit in terms of my own perspective. So I've worked both in California and in New York with CHWs, where the use of CHWs is very prominent. And so here, when we first arrived, the use of CHWs is not as prominent, but is growing as we see in terms of the differences between this assessment and an assessment that was done earlier a few years back. So this is very promising. I do appreciate what you're saying in the sense of, so how do we actually compare in relationship to narrowing to neighborhood states? And I do think that that would be a next step. But I think before we can engage in that, I think the first primary step is to understand sort of what are we doing currently.
Yeah, and just to add on to that question, again, fantastic question. We have talked to some partners who are outside of Indiana, just kind of getting a general sense. For example, Michigan, Michigan actually has a mandate that says per X number of beneficiaries, an insurance company has to have X number of CHWs. And so we had a meeting with an individual from Michigan who could speak to this a little bit, and learning from her, it says that it really, even with a mandate that you could think, oh, well, that would be amazing, right? That's how you expand the CHW workforce. You make a mandate and it'll be great. But there were real downfalls to that in terms of, with the mandate, you really lost sight of the natural helper type qualities of a CHW. And I think there was not as much attention paid to really recruiting from the communities with whom they were serving. It almost sounded like, here's a job post, here's kind of what you have to do, and then whoever applies for it fulfills that role. So I think, again, to the credit of the question, we are learning where we feel there are opportunities to learn from other states. Also had a meeting with people from Texas who are well above and beyond with their CHW models than what exists in Indiana. And so again, having connected with those individuals and learning from their initial experiences is also an important part of our process. So we are attuned to it. And I think, to you, Mari's point, most of our time and effort is dedicated to ensuring that we have engaged all of the right stakeholders here in Indiana, and making sure that we are most familiar with the Indiana landscape, to be familiar with the nuances here before we reach out to other neighboring states. Thank you for the question, though. It was good.
How do the CHWs differ from the health coaches we heard so much about a year or two, I think they mean, or maybe longer ago?
Who wants to take that one? You, Mari, do you want to take that? I mean, I can take it too.
So I think that what's interesting is when we recruited, so what we did was we were trying to understand in terms of how CHWs themselves view their work and how they view their work differently depending on their title. And so we were asking that. And what we saw, if I understand the question, it's how does CHWs differ from health coaches? Well, I don't actually think that they differ quite so much, at least from the perspective of of the participants who engaged in our focus groups. Many of them talked about expanding out the services that are already provided by, say, their organization, by providing additional education to their participants or to their clients. But they may not necessarily have held the title of health coach. They might have held the title of community health worker instead of that. So many of them talked about providing education, changing behavior change, understanding different kinds of, and receiving some trainings, for instance, in chronic management, so that they could work on efforts to be able to help their clients manage their chronic disease, for instance. So in that sense, so I hope I'm answering the question. If I didn't, please let me know.
And I would add on a little bit to that. I mean, just kind of thinking about the experiences at Eskenazi, where I practice clinically, where we have both health coaches and community health workers that are involved in similar care, but maybe slightly different. I would say, that the community health worker may have a slightly broader focus on helping overcome barriers to sort of care as a whole, compared to health coaches, which may be focused more on a specific disease state or potential clinical outcome, as related to a community health worker that's, sort of more of a broad, holistic type of approach. There certainly is overlap. There certainly may be instances where they're doing the work of both, but have a certain title. And that is part of what some of the discussion and things that we have found related to sort of how do you identify as a community health worker versus a health coach versus a certified recovery specialist, and should that matter? Does that matter? Or does it need to be much more streamlined and focused? So that's part of the bigger conversation that's happening as well.
I agree. And I think it taps back into Mike's earlier question in terms of experiences and challenges, right? So one of the common themes that emerged in terms of our discussions with those that are working in CHW work is, like, how do we clarify the kind of work that we do and make it so that there's an understanding of what CHWs do? So that still is quite vague here in Indiana. Like, we're still struggling with that. They're still struggling with that. Don't necessarily, like, again, in California or in New York, there's more clarity around that. And I think that struggle expands beyond just the CHW, because if employers don't actually understand what a CHW can be, then they themselves struggle with, so when can we hire them? What role will they play?
And what can you bill for? And therefore, what can we, put into our budget to hire people for, and the ripple effect from there. So excellent. Not excellent. It really compounds the problem, but you can see how it gets really gray, and certainly that makes it difficult for our rural providers. So
Absolutely.
Yeah, Allie, we have questions too. I don't know if there are more questions.
I was going to say we don't have any more questions.
Okay.
So I was going to really exhort our attendees to try to submit some more, because you guys are providing really in-depth answers, and I appreciate that. So yes, please, if you have questions you'd like to pose to the attendees, this is a great time for that.
Well, sure. I want to get a sense for, because the questions I ask are really pretty specific. So does anybody who in the audience has CHWs that they're working with, or what are the audience members' like relationships with CHWs or interest in CHWs?
And I'll also say, attendees, if you would like to speak verbally as opposed to just chatting in, if you just raise your hand, I can give you the ability to, I can give you the microphone, if you will. And you're also still welcome to use the chat.
And it could be, not knowing some of the people who are attending. It could just be that you have an interest in CHWs or wanted to learn more about CHWs. So that's, one of the questions that we do have that is less, you don't have to be employing CHWs, is what opportunities exist for CHWs to improve rural health. So just from your perspective, kind of knowing the work of CHWs as lay members and really as connectors, natural helpers, providers of resources, from your perspective and involvement with rural health, how do you think CHWs can be most helpful? Asked in a different way, our other question is also, what are some of the main reasons for rural health disparities that CHWs could help overcome?
And given the work that you do, maybe what we can say is, so what, in your opinion, what are the drivers of health disparities in rural health, in rural areas? What might be some of the disparities in rural areas? And then like a follow-up would be, and if we can identify what might be those drivers, maybe we could also identify how community health workers can help reduce those drivers, eliminate them, mitigate them.
Well, in the meantime, because I'm going to assume that everyone is furiously typing out very, very long responses to your questions. I mean, one of my roles at IRHA is to complete community health needs assessments. And this is not going to shock any of you guys, and it's all going to be anecdotal, but what I hear again and again is, well, we have these resources in town, people just don't know about them. There's no singular resource that people can go to. There's no one aggregate place where everything's written down, and the contact information is changing. And Susan used to work there, and you used to call Susan, but Susan doesn't work there anymore. Now she works at the other place. And if you call her, she doesn't know that Becky doesn't work down at the station anymore. Becky works over at, so, you know, community health workers can absolutely be those connectors. They can be that hub for the information and can kind of keep, being the connector, can be that central resource. Which you have touched on. And like I said, I'm not going to blow any of your minds. You know that in rural communities, they can be such a wonderful connector and convener. But every time we go into a community, that comes up again and again and again. And then my own knowledge gap, I'm not sure how much of this role they fill, but just following up with patients. We know when you do those follow-up calls or texts or whatever it is, time and time again, when we see these little pilot programs with the heart failure patients where you ask them to weigh themselves and, oh, you gained X number of pounds. We know there's something going on. You need to get follow-up. Anything like that where you have somebody following up and not waiting until somebody pops up back in the ER. Anything like that with chronic conditions, diabetes, heart failure, etc., that is higher rates typically in rural, is always going to make a huge, huge impact. Again, I don't know that that's something a community health worker does or a health coach, or what, but these are long-standing and severe issues in rural areas that I know about from anecdotal standpoint.
So, Allie, just to kind of build on that last point, I mean, that certainly is within the clinical sector. That certainly is a role that community health workers do take on, is that close patient follow-up. It's taking their prescriptions to their homes if they can't get out to the pharmacy to pick their medications up. It's calling to check on what are their blood sugars and are there other issues going on within the home that may be impacting that chronic disease or that condition, that either can be addressed through the community health worker, or that they can be connected to a resource or service that can help them sort of navigate through the other aspects of whatever may be going on. So there certainly is a large role for within the clinical sector, specifically focused on that chronic condition management. And some of that, you know, when we were having our conversations with employers and trying to show what the impact of those CHWs are, you know, some of the ways they were trying to show that were by by decreased emergency department visits, higher utilization of primary care services, as opposed to those more urgent or acute situations that would result in admissions or higher costs. So that is definitely something that is being sort of looked at and documented and sort of tracked, at least at some level in some pockets across the state. But where we see there being, a gap is that that's not consistent, and best methods for doing that are not being shared or consistently used to show the impact of the workforce as a whole, as opposed to the one-off siloed location that may be choosing to track those outcomes in a certain way.
Sure. I assume reduced readmission rates are tracked too when you talk about reduced ER utilization too.
They are. And I mean, it's hard to tie it back directly to the work
Sure.
that the individual community health worker may be doing as compared to, the care coordinator at the last
Yep.
discharge versus, what piece of that, but
Sure.
certainly readmission rates are a piece of that.
We had one person comment in certain cultural aspects, to answer the question, such as rural Amish communities in northern Indiana and hesitancy with immunization rates.
Yeah, I have had so many conversations about so many different communities of people having vaccine hesitancy, and how many people are trying to address that, and effective ways to address that. And it's compounded by lack of access to the vaccine for whatever reason. So it's a complex issue that everyone is talking about right now. But I've also seen, where did I think INCHWA maybe posted the article. I think Brianna's on from INCHWA, but INCHWA might have posted the article about how CHWs are helping with directly that issue in terms of being that connector to, any community that may have mistrust for whatever reasons towards the healthcare system, that a community health worker who comes from that community and can be a resource for education and access to the vaccine is an amazing asset for a CHW to have for this specific issue. And so I think that it's a really good point, and you can pick whatever community that has obstacles to either wanting to receive the vaccine or literally receiving the vaccine. And I think CHWs are one kind of ideal avenue to begin to help address the vaccine hesitancy problem.
I also wanted to just highlight, and I appreciate Allie's example, because it talks about the importance of using CHWs across the continuum. So we often think of CHWs in terms of treatment and how to maintain treatment and follow up after someone has, or population, has had treatment, but the importance of prevention, right? And how if you are aware of the resources that are available to you, then it can increase the likelihood of individuals using those resources, and then that can actually decrease some of the risks, right? So you can get those tests early on, you can get the vaccination, you can get the education, those kinds of things. So I really appreciated your example and your comment, because it really kind of talks about, oftentimes we do think of CHWs in terms of working at the end of like helping once someone has already received treatment, but just kind of thinking about how do they prevent illness. And the reason this is quite difficult is if your population isn't ill, you actually don't have the outcomes. You can't say, like, if they never got ill, you can't say, well, this portion of the population never got ill, and this is why they're impactful. But if they're actually helping to prevent that illness altogether, that is the impact, right? So I just wanted to kind of share my thoughts on that, and just how much I appreciated your example.
Yeah, like trying to prove a negative, you can't.
One other question we have here, again, trying to pick everyone's brains, are do you know of organizations interested in starting up a CHW program, or Are any of you familiar with what the needs or challenges to do so are? And if there are no bites on that one, I'll make up another question. But I think maybe there might be some responses here too of, what are we missing? What else do we need to be addressing? What didn't you hear in the presentation that we should be doing? We are completely open to hearing that type of feedback as well. Or what are we doing wrong? Tell us. I mean, we again, with our kind of intention of being transparent, we are also completely open to any feedback of how things should be done more effectively, and we take it to our steering committee and ask their opinions. So we are very open to different perspectives and learning from others. So does anybody have any comments on that?
Again, while everyone furiously types in their long responses, I don't think there's anything that you're missing or doing wrong at all. This is excellent information. But I know one of the things that we always have asks for is uh, you mentioned people are maybe misinterpreting or not fully understanding the billing aspects associated with the CHWs. We always have asks for our members. Okay, if we're not understanding, teach us how to bill and charge for at the highest possible level. Make sure we're billing for the services the best way we can. So if there are any resources that you know of, we would love to do another presentation or direct our members to those resources to help them out.
Allie, that is, I believe, one of our specific recommendations out of our needs assessment is that so much of what we heard was exactly that, Allie, is like, wait, I mean, we got some comments that reimbursement doesn't exist. And we were like, that's so there's an area for improvement there. And then those who were familiar with the process were just overwhelmed and confused by the complexities. And so one of our efforts is, okay, we're fortunate to be in a state where it does exist. And I think that there are people who recognize that at least it's something, right? Because some states don't have the infrastructure at all for reimbursement. So there is a benefit to it, but with the underutilization of it, we clearly have some opportunity there to, even without revision to any of the regulations surrounding it, there's opportunities to improve the utilization. And that could be through additional education, Q&A with the experts, and that is on our radar for sure, Allie, because that was something that was a resounding issue amongst our stakeholders. I'm not going to force any more questions. So if people would like the extra 6 minutes to not stare at a screen, completely happy to hop off here as well. And we're open to follow-up emails or questions, and always you can Google any of our names and Purdue and find our contact information really easily. So please reach out to us if there are additional questions.
And we did just get one last minute question here. Just curious if you've thought of ways to build CHWD, or maybe that was just supposed to be an S, ways to build CHW training focused on training to have more diverse demographic of CHWs in Indiana.
I think the best way to answer that question, and you, Mari and Ashley, you can also add to what I say, but it's so ingrained in us that we almost, I don't know if we've had that deliberate discussion, because of course, of course, that would be the route that all of us would be so passionate about supporting, and we do actually know that the pool of CHWs is more diverse than other employee workforces, right, across Indiana. So, but it is noted that your comment, there does need to be a deliberate effort to ensure that the diversity of the CHW workforce is what it needs to be and matches the communities who need it the most.
And to just kind of add on to that, I mean, our whole approach as we're talking about workforce development is not let's just train a bunch of CHWs and set them loose. Our intent is really to strategically create opportunities for CHW employment. So we don't want a whole bunch of trained CHWs that have nowhere to work. We really want to create those opportunities for them to fill. And so a key part of that is working within communities that have a need or that we see a need for community health workers and the ways they can benefit. And at the core of it, we're looking for people from that community because they can make those connections much more easily than someone from outside of that community. So I think naturally within our approach, like Jasmine said, it's kind of ingrained in us, but to verbalize that, I mean, the way our approach, we're driving that is to start at the community level to see what the needs are and identify opportunities for community members to fill those gaps. So I think as we continue to build that way, we will be sure to make sure that we have that diverse population of community health workers to reflect the demographics of the communities they're working in.
So I actually really like this question as well, because so here I'm wondering if what the question that you're posing is about training the CHWs themselves, or is it your recommendation is by enhancing the awareness of what and whom CHWs are, then there could be more opportunities, say for job training programs, to be able to then talk about CHW as a potential profession. And the reason, so my thinking is this, so the work that I do, I work with Latino migrant farm worker families. And one of, there are individuals or organizational representatives that go to the farms and they talk to the families, to the farm workers, in case they're interested in doing, say, a job training or a job switch. And so I'm wondering, are you saying two things, right? One is the training of CHWs themselves, but then I'm wondering, are you recommending that by enhancing the conversation of who CHWs are, then creates a potential for, say, these kinds of organizations that create these retraining programs to then offer CHW as a potential profession?
The latter, like go to predominantly Black churches, boys and girls clubs. She says, yes, exactly.
Yeah, yes, I absolutely agree. And I think that what you're saying, and I do agree with you, I think that if we then in Indiana and in other states really clarify what is the profession as a CHW, not only what is a CHW, what is the profession, where do they go? Like, what is the advancement for CHW? And then there's clarity. Then you can have organizations that are trying to say, like for high schoolers who are not really quite sure where they want to go. So, hey, here's this job, and then have an option as that CHW. And I appreciate that recommendation so much. And I think that some of that can come from the clarity of understanding what that profession means, and the opportunities that come for those who then engage in that. And I think by doing that, then we can start to diversify.
Well, on the heels of what is turning into a really interesting conversation, and maybe not even where we started off, it is 1 o'clock, so I do hate to shut it down, but we do try to keep these right at an hour. So I really appreciate everyone's time today. It sounds like we have a lot of great material to probably do another session, at least one in the future. Got a lot of great comments. Just wow, what a phenomenal team of women. Such great information. Thank you so much. A lot of that kind of thing coming in the chat. I know I've learned a ton today. As I said, this is recorded, so we'll be posting this to our YouTube channel, and I'll be happy to share this with the team as well. If you have anyone you'd like to share this with, post to any of your own websites, etc. Just so appreciative of everyone coming on today and sharing about this great program. Hope to work together some more in the future. So thank you, everyone. Enjoy your afternoon. Look forward to seeing you all again in the future.
Thank you.
Thank you.
Bye.
Thank you.